Okay, one of the most common mistakes I come across in papers from Asia are the spacing. So here you have the spacing here. And also this is down here, it should be continuous. Okay. The human lens discolors to yellowish. Well, you understand what it means, but it's not the best way of saying it. The human lens becomes yellowish, or becomes yellowed, or becomes yellow in color. Plays a role. Now, this is a very common mistake, this mistake of the spelling of the word roll. This is a roll of bread. Plays a role in protecting the retina. Plays a role, R-O-L-E, to have the, like an actor playing a role. A white necrotic coat can be seen at the middle lobe orifice. It's more correct to say at the orifice of the middle lobe bronchus. It's the bronchus of the middle lobe that has the necrotic coat, not the middle lobe. Okay. Nevertheless, there was a difference in the pathogenesis between 1, 2, and case 3. Now, what does that mean? Between 1, 2, and 3, or 1, 2, and 3? There appeared to be a difference in pathogenesis between cases 1, 2, and case 3. So in this case, it should be that 1 and 2 are together, and case 3 is separate. Again, this is a question of spacing. And I don't know about Korea. In Japan, they don't teach spacing very well. And if in Scotland, I learned spacing when I was 4 years old. And so if I get a scientific paper from Dr. So-and-so and title page, there are mistakes in the spacing, he's below 4 years old. I mean, really, it's one of the most basic things. You can't make mistakes like that. An egg-sized mass, okay, fine. What kind of egg? Ant? An ant's egg? Caviar? Ostrich? Give specific numbers. And again, with a space. The only time you don't have a space after a numeral is percent and degree, as in degree centigrade. Apart from that, you always have a space between a numeral and a unit. Only side effect is fever at the infusion day. Again, it's understandable. The only side effect was fever, comma, observed on the day of infusion. That's a much more flowing sentence. So 6 cases of fungus ball type pulmonary aspergillosis admitted at our hospitals. So that means the aspergillosis got up, and the aspergillosis decided to admit Bundang Hospital. So congratulations. 6 cases of fungus ball type pulmonary aspergillosis were admitted to the author's hospital. Okay? Were admitted to the author's hospital. Chest X-ray demonstrated abnormal shadow in the left island. Okay, can you see an X-ray? No. You can see X-ray film. But So also, just because you saw it in an American journal or a British journal does not mean the English is okay. In Britain, America, Australia, there are first-rate journals, second, third, and fourth. And some of them have pretty bad English. So in the New England Journal of Medicine, you'll never see this. You'll see this, an abnormal shadow in the left hilum. Again, a 75-year-old man had the right upper lobectomy. We have a space here, and had, I think, underwent might be a little better, to undergo a lobectomy. Which is quite useful. Again, this gets back to what I was saying earlier about significant. What does significant mean? What does quite useful mean? So if it's useful, it's useful. If it's not useful, it's not useful. Quite useful means nothing. Torsion middle lobe of the lung after right lobe of the lobectomy case report. If you say a case of, then it's one case. So you do not need this secondary title, okay? A case of torsion of the middle of the middle lobe of the lung. Sorry, middle lobe of the lung after right upper lobectomy. Table 1, respiratory function, before or after. Well, if you say before or after, then you can take your pick. Which do you want, before, after? Before and after, okay? In the patient's medical was pulmonary tuberculosis at 33 years. This is understandable, but the patient's medical history included tuberculosis at age 33. The patient had had pulmonary tuberculosis at age 33. Well, this is shorter, so I would prefer this. But if you want to emphasize medical history, okay, but this is enough. This means it's in the medical history. And recovery proceeded well. Well, if he recovers, it proceeded. So recovery was uneventful, so it went forward. Mass lesion with the size of 8 by 10 centimeters at sharp edge was present. Mass lesion, an 8 by 10 centimeter well-defined mass was present. If you have mass, you don't need lesion. So an 8 by 10 centimeter well-defined mass was present. And well-defined takes the place of sharp edge. If you want, if it's a resected specimen, you can say a sharp margin or a very distinct margin. But if you're talking about the radiological findings, I would tend to say well-defined. It will be possible to have good senile lives. Now, senile has a bad meaning. If you say he's senile, it means he's lost it. He's not functioning normally. So good and senile is impossible. He had a good drowning. It would possible a good old age by improving their lifestyles. A good old age, right? Or a good elderly life. The addition, age-related reduction in BMD to postmenopausal, the additive effects of age-related education, reduction in bone mineral density to postmenopausal. So additive effects rather than addition. Now here, a 59-year-old man was admitted. It's better to have this in numerals with a hyphen, 59 year old man was admitted. As a step to clarification of causative of, this is very strange, as a step towards the clarification of. Step to clarification is a little too abrupt, towards the clarification of. In the same way as previously reported, it becomes according to a method previously reported, or according to a previously reported method. Either is okay. According to a method previously reported. Submucosal invasion in the bronchial wall was not presented. Now, here, presented is normally used talking about a patient coming to the hospital. The patient presented with cough and fever. The person means was present. Or submucosal invasion in the bronchial wall was not recognized. In other words, it might have been present, but it was not recognizable by the endoscopic findings. Measuring BMD of the measurement of the second metacarpus, or second metacarpal. Table 1, again, you have the space here, it should be here. Table 1, laboratory findings on admission. You don't need to say taken on, just January 18th, 1988, and you don't need a period, just a comma. 96% of primary malignant lymphoma of the liver was of B-cell origin. I would tend to use the plural, lymphomas of the liver were of B-cell origin. As far as we can tell, this is very colloquial, spoken language. It's fine for spoken language. As far as we can tell, but to the best of our knowledge. Now here I would like to emphasize, do not say to our knowledge. Say to the best of our knowledge. If you say to our knowledge, it means we are sure. And in our knowledge, of which we are sure, A is greater than B. But to the best of our knowledge, A is greater than B is, we think so, that's our best estimate, but we might be wrong. But to my knowledge, London is located in England. I think that is an absolute fact. Okay? To my knowledge, I'm very sure of that. So to make it a little softer, to the best of my knowledge, London was founded 3,000 years ago or whatever. However, when we compared the two groups of patients of recurrence, increased PVP, and the patients of no recurrence with increased PVP, I would go for the third one, which is, however, when we compare the two groups consisting of increased PVP with or without recurrence, two groups of patients of recurrence with increased PVP and patients with no recurrence with increased PVP. So here it's saying both have increased PVP, and one group has and one group has not recurrence. Okay, here we're talking about informed consent. The purpose of the procedure not was informed, was explained. You explain the purpose to each patient in order to get their consent. Okay, in 27 patients with esophageal viruses, endoscopic injection sclerotherapy was conducted with subsequent follow-up for more than 1 year. Now, the important thing here is front loading. in this sentence, what you are talking about, the main thing you're talking about is endoscopic injection sclerotherapy. The main thing is not 27 patients. So you bring endoscopic injection sclerotherapy, EIS, to the front, was conducted in 27 patients with it. So that makes it easier to follow, just like in a paragraph, the first sentence, the topic sentence, you give the main argument or the main point of the paragraph, and then the rest of the paragraph should support that. Then you go to the next paragraph. So this is the topic part of the sentence, front loading. We often get this medical collage put together from many different things. You see this a lot, actually. These foci might already be on the way to cancerization. These foci might represent a stage in the process of malignant change. Cancerization, it's not impossible, but it's rare. So I would say malignant change, I think would be a little bit better. Our results are almost coincident with our findings. That means our results are different from their findings. If I say almost the same, it means they're not the same. Are similar to their findings, or are almost exactly the same as theirs. But almost coincident means, it's just like yesterday, I almost went to Busan. I didn't, but I was thinking about it. I asked about train tickets or plane tickets. I was seriously thinking about it, but I didn't go. I almost went, but I didn't. So here, almost coincidence means not coincident, okay? Much debate has been made on this matter. Much debate has been devoted to this matter. You don't make debate, you devote or hold debate. Much debate has been devoted to this matter. Only 1 out of 105 nuclei showed over 6C value. Only 1 out of 105 shows a value of over 6C. This is a kind of adjective, over 6C value. It's a little bit strange as an adjective. So a value of over 6C. Since the 1980s, several studies were performed. You need the 1980s, the 2010s, the 2000s, since the 1980s. The is important. Menopause does not influence BMD evenly at every bone. Menopause does not uniformly influence BMD in all bones. So every bone, all bones. And influence, even uniformly influence, would be more acceptable. Which is inferior to CT with regard to accuracy, which is less accurate than. And so here you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6. So 2/3 of the words. And the shorter the sentences, the more easy to understand usually, and the more impact, and the less effort. Again, you've got to make it easier for the reviewer and the reader. Differently from peripheral bones, unlike in peripheral bones, okay? A 78-year-old female was diagnosed as primary tracheal adenosis with fibroscopic examination. So the important thing here is you do not diagnose a human being. And age 18 or over, it's woman, man, not female, male. Female is an adjective. You only use female as a noun if you have mixed ages below 18 and over 18. The group consisted of 18 females ranging from age 14 to 45. Okay, if it's age 14, they're girls or adolescents or teenagers. If you want to look it up, look at AMA Manual of Style, look at the index for age. And they have a whole series from 0 to 4 weeks, I think is neonate, and then you have infant, child, girl, boy, teenager, and they're very precise ages, what you can use these for. And diagnose, this gnos, is the same as the English to know, kno, right? K-N-O-W. This is G-N-O. It's the same as K-N-O, kno, to know. And dia is thoroughly, to thoroughly know. Well, you thoroughly know the disease, not the human being. Of course, in Britain or America, everybody says, oh, he was diagnosed as arrhythmia or something, but in speaking. But in a top-class journal, you will not say he was diagnosed as arrhythmia. He was given a diagnosis of arrhythmia. Arrhythmia was diagnosed. Results, further detailed examinations yielded a diagnosis of, but you don't diagnose a human being. Again, this is a use of capital letters when you don't need them. For the color vision test, we employed the ISHIHARA chart. And unless this is a registered name, you put these in small letters. She had been administered. Administered is usually used for governing, or she had been given, or the agents had been administered, but not she had been administered. Okay? Had been given. Usually given is quite a safe word to use. Pathological examination showed infiltration of mononuclear cells. The pathological findings revealed or showed infiltration of mononuclear cells. And I tend to use findings rather than just examination. It could be a personal thing, but the pathologic examination showed infiltration of mononuclear cells. It's also possible. Reference should be references, okay? And in the book, in the references, you never put in preparation or in submission. As I said yesterday, it's data, unpublished data or unpublished observations. So no data or paper that has not been published or accepted for publication can be used as a reference. Same for in submission. And in tables, this means no reaction. So here indicates no reaction, not corresponds to. And again, percent. This, when I wrote this, they preferred 10%, but now the New England Journal is using this. Again, read your target journal. Obtain the opposite from patients. And this is a question of the spacing. Okay. There's also another one that I come across. The patient performed bronchoscopy. The patient performed bronchoscopy. It's not impossible. I know 2 people who did bronchoscopy on themselves. One got pneumothorax. It's not impossible, but it's highly unusual. So the patient underwent bronchoscopy is a little better, okay?